one other question real quick is, we've talked about the number of cases, but I think one thing that I was curious about is, it seems like a lot of these cases, for a majority part, are in what I would call pods with, the nursing homes and certain locations. Have you guys been able to identify that yet, and kind of quickly say, okay, we know we can track the majority of, or a percentage of cases in these particular pod areas?
Mr. Shelton, I think that one probably be directed to the health department.
From a hospital standpoint, I would definitely say, yes, the cases have been in families or in a specific household. That's what we've seen as a hospital, but public health would have sort of the majority of the information for the whole.
And so less of just, wow, we have no idea where this came from.
Yes, there are clusters, and they do have a map of those clusters, and that's what the media has been asking for, and they have identified them, and that's how they, with this contact tracing, is how they found the 4-month-old. Through contact tracing is how they found the Easy Rider. So there are clusters, and there are family groups that are getting it. And so we are watching that, and that's part of the health department's priority at this point, is to find those clusters.
Anything else, Melissa?
Thank you.
All right. We got a couple questions on Facebook before we go that I wanted to get to. This question's kind of for the hospital. The first one was, I'll let each hospital talk on this one. I think it's important to note. They asked how the hospital is dealing with cross-contaminations. Are the nurses and physicians and staff that are working on the COVID-specific floors also working on other floors as well in the hospital? Kristen, Kristen or Dr. Davenport, you want to take that first?
Sure. Within Medical Center Hospital, we have very specific staff that are working in our 2 COVID departments so that we limit that. And then we also have, even within the departments, that whether you're a positive or you're a PUI, you have very specific staff taking care of those specific types of patients, so that we don't have a nurse taking care of a positive as well as a PUI. So we are watching exactly who is taking care of what. And then that way they have their proper PPE according to those patients as well.
Dr. Servanen?
Yeah, we have a separate PUI unit and a separate COVID unit, and the staff that works in the PUI unit or the COVID unit do not work anywhere else. And even between the PUI and COVID, staff is not shared. They're separate locations, but they can't be shared staff.
Okay, thank you, Dr. Servanen. One other question was, being at the, you had mentioned the rise of the curve. I guess I'll deviate to Dr. Servanen and Dr. Davenport. Obviously, we have not reached that peak here in the Permian Basin, and I know we only have educated data to guess on, but do we have any idea, if we maintain the current practices of social distancing, when Ector County or West Texas might see that peak?
I think if we had an answer to that, everybody would breathe a sigh of relief. But unfortunately not. As Dr. Servanen said earlier, and I would echo this, obviously the more testing we're doing, the more, and until that number actually starts to flatten and starts to decrease, we're just going to kind of have to keep up business as usual. So continue to monitor people for symptoms, continue to treat, continue to isolate the hospitals, and we discussed a little bit about the surgery side of it, and it's the same thing on that part. Trying to prevent people from being exposed is our number one priority.
Trevor, I had shared 3 different projections so far in all the different conferences we have had. Those projections specifically showed either end of April or end of May. And so I would say if we had to predict based on those projections, somewhere in between the end of April and end of May is when we're going to have our peak.
Thank you, Dr. Servanen. And I've got one more question coming in from Laura Dennis, who's the OA editor, still waiting on that But I wanted to discuss again, is it good at this point? I know there's, Stacy had mentioned that we don't have a lot of positive patients in the hospital. MCH only has 3 confirmed positive patients in the hospital despite 60-something cases, 28 recovered. Do we see that as a good sign right now, that despite our cases increasing, we are not seeing a massive surge needed for hospital care right now?
I think that's a fabulous thing. I think the idea of isolation, I think the idea of quarantine, I think the idea of social distancing shows that we're doing what we need to do. The public really helping us with regards to that. That we don't have these surges in the hospital, that we're able to protect our PPE in case we do have a surge. Certainly with exposures and identification of patients in the nursing home or these enclosed populations, that can make it a little bit different, and those are more difficult, and those are the concerns that are arising in this time. The what if this surge happens in a nursing home? That's what we have to look at ahead of time and be prepared for.
And the one thing I want to add to that is, don't forget that there are still medical conditions that require hospital visits, that still require surgeries, it still requires ER. And I am encouraging everybody to not be scared of coronavirus and not seek care. People are still having strokes and heart attacks, so please do seek care appropriately when you need it.
Okay, and then Laura, I see, has joined in the picture next to Mike, the ODESSA American. Laura, you have a question?
Yeah, I do. After Commissioner Shelton mentioned that some questions had been answered on Facebook, I went to the Facebook page, and sure enough, there were some answers to some questions that some people had asked on Friday. But my question is, if the health department director, which this is going on all over the country, these types of calls, and health directors all over the country are making the time to answer questions. If they have time to answer Facebook and to text Commissioner Shelton during this meeting, why can't they pop on and answer questions?
Well, Laura, they could, but I think that the time spent doing contact tracing would be better served by the director, by her directing her staff how she sees fit. I think that her time with her staff is more valuable at this stage of the I hate to say stage of the game, that's just, but at the stage that we're in, her time with her staff is more valuable setting up that contact tracing than.
But she's answering on Facebook and she's texting you. It really is just that she doesn't want to be on here, because I think that it's because the questions are difficult. And on the map answer, just so everyone else knows, Devin is getting that map ready by the end of the day today. They were under the impression that the county attorney was going to send something out last week. And we, please don't misunderstand, we appreciate you being on here, but you know, someone has to text you something, or then they go and answer it on Facebook to a Facebook page that has 2,000 followers. When, what do you guys, Melissa, have 200,000, Channel 7? You know, all of us together probably have 500,000 followers, but they're putting their answers on a page and thinking that that's adequate. And it's really not adequate, because the question and answer process is fluid. A question is asked and someone answers it, and then maybe Danny has a follow-up question. Oh, well, what does that mean? It's you know, it's not doing a service to Ector County or to Odessans to not have those people front and center.
Laura, as I stated, that her staff is answering the questions, her staff is responding to text, and her staff is responding to Facebook. Whether she is actively typing or actively dictating, I don't know that, but I do know that she's actively saving lives. And I think that that's more important at this point. And
Well,
So
no one's arguing that saving lives isn't important, because that's like a fallback. Well, we're saving lives, we can't do anything else. But someone is doing that stuff. And if they could be here to also help you answer the other questions, things that maybe that you don't know yet, that would be helpful. I'm not even speaking for just as a member of the media, for citizens. So many people watch these every day on all the different news stations and on Medical Center's Facebook page. I mean, it's very important. And I don't know that they're streaming this on the health department page. I didn't see it when I was on there.
Well, I chose to be remote. That's my choice. I'm getting the information that she has, and I'm getting it to you. By the end of our conversation Friday, I had most of the questions already answered, and today I've got them all answered. So this is how it's going to be.
Well, that, I understand that you're saying that's how it's going to be. I'm just saying I don't think it's the best service to people in Ector County to not have the answers to the questions. And if you'll notice, Trevor also reads questions as we go. And the questions that you said you had by the end of the day, I just found them on the health department's Facebook. I didn't find them anywhere
Are the names of those local doctors' offices on the Facebook?
That's not something that we can divulge.
Okay.
Wait, Eddie, you can divulge nursing homes, but you can't divulge doctor's offices
That's what I was told.
by
The health department.
Eddie, with all due respect, and this is more of a comment than a question, two hospital CEOs, if anybody is saving lives, it's the hospital CEOs, it's the two doctors we have on this call, it's the head nurse we have on this call. And I think it's very discouraging and disrespectful that the county judge is not on this call, who's in charge of the county, and that the health department director doesn't have the time to spend 30 minutes answering constituents' questions. That's all.
My feelings aren't hurt. I'm still going to be here. I'm going to do the best I can. I'm going to work hard for you guys. Just so you know, you'll get all you could from anybody else, from me. So just hang in there. This is going to work out.
But you have heard of the word optics, right?
You don't like the way I look?
No, I love that starfish. You make me feel
You
like
like?
I'm at the beach.
Yeah.
No, I love the way you look, Eddie. Let's
We're
go get a
glad to
beer.
have someone on here. Yeah.
All right. Before we close it out, I think, Russell, you said you had wanted to say another word real quick.
Yeah, before we close out, I know with all the drama that we're all having with this and with what's happened in our oil field today, I only felt it appropriate to share Philippians 4:6 that tells us, do not be anxious about anything, but in every situation by prayer and petition with thanksgiving, present your requests to God. And for some reason, I felt like I need to share that with this group and for people who log in to listen to us, that we know who holds the future and that our Lord above is bigger than any oil price or any pandemic out there. And I wanted to say that.
Thanks for that, Russell.
Any other questions, anybody?
Yeah, is there any update on the children who are positive cases? Can we get an update on those?
So the children is in the family where the 4-month-old, 11-year-old, 13-year-old, the mother did test positive, and the 13-year-old was referred to a hospital.
Okay.
That's all I have on that.
Okay. So it was a mother and a grandmother and the 3 out of 4 children.
That's correct.